Okay, today I'm going to show you how to use the vocabulary trainer ProVoc with a file containing all the drugs of the second year pharmacology course for medical school in Cambridge. So if you follow the link on my website, you get to the download page here where there's a button that lets you download the program. So I've already installed it on my computer, so I'm just going to launch it. By default, it will open up the last file that you've looked at, which is my pharmacology drug file in this case. But if you've never opened the program before, it brings up this window and you just open an existing document, which should be the file with all the drugs that you've downloaded from the website. Here we go. Now you can see the way the program is laid out. On the left, it shows you an overview of all the lists of drugs that are available. And just like in the spreadsheet that you can find on the website, I've organized them all by lecture series. So number 1 is the Professor Hiley's lecture series on drug receptor interactions. The second one is on peripheral neurotransmission, then cardiovascular and renal, and human aspects of it, and so on, all the way till the end, okay? And on the right window, you can just see the drugs and their definition. Okay, so for today, I've prepared a special short list down here. Let's zoom in a little bit. So you can see here the drug name and the definition for each drug. Okay, so now we want to familiarize ourselves a little bit with the drugs. For this, you go to vocabulary up here and then start slideshow. So now the program is going to play you a slideshow with all the information, and you can just sit back and have a cup of tea and watch the slideshow. Okay? You can also let the computer read these out for you if you like, if you don't want to read it. Okay, let's say that we're done. And now we can go over here. You see on the bottom there are 3 buttons: editing, training, and history. At the moment we're in editing, so let's go to training because we want to train ourselves. And here you see all the different options for how to test your knowledge of the drugs and the vocabulary. So I recommend using First Contact, which at the moment is set up to show you 3 multiple choice answers available for each drug name. And there are some other things that you can specify if you like. And now to actually start testing yourself, you just press the play button up here. Okay, so here's now a drug name, the first one of 10, nifedipine. And at the moment it's set to have a little delay before it shows you the actual answer, so you can just think about it for yourself a little bit. So if now you know what's going on, you press this play down here. And we know that nifedipine is a calcium channel antagonist. It's a dihydropyridine. So let's select it. And green light flashes, that means we were correct. Okay, glibenclamide is a sulfonyl urea. Nicorandin is a potassium channel agonist. And I think it's the one with a more elaborate explanation down here. Okay, so now we know how to do things right. Let's choose the wrong answer. Amlodipine is definitely not a calcium channel agonist. So now you see it flashes up in red and shows you the correct answer that you were supposed to give. So now, let's say for now we want to finish. So you can either pause it if you want to go to the loo, or you can finish it, or you can just keep on going till the end. Let's finish it for now, and it will show you how many answers you had correct, how many you've had wrong, and how many you've left out. If you want, you can go back and repeat the incorrect words, or you just press done if you're done. And over time, as you're training more and more, if you go to the history tab down here, you can just see the statistics of your hopefully improving performance. So that's really it already. That's how you use ProVoc. Thanks very much and good luck learning the drugs.